Hi, good morning. My name is Anthony and I'm a respiratory care student from respiratory care department. So would you mind if I'm going to stand beside you? I'm going to check your patient identifiers. So first and foremost, by the way, before going to the patient's room, I have to verify the patient's order by looking at the chart and checking all the necessary details, the patient's information, and even the important thing, such as looking if the patient is taking up blood thinners or have anticoagulant medications. So after that, I already introduced myself, asking the patient's name. I have to assess, check the vital signs, and once I'm ready, I'm going to explain to the patient what I'm going to do. So the patient Scott, the doctor ordered you that I will take up an arterial blood gas. So for your own knowledge, uh, the test that I'm going to do is different to the other ones because I'll be taking this one up to your artery. So the reason for this is because we will going to measure your oxygen levels to your blood, especially with how you complained earlier that you're having trouble breathing. So for you to know, I'm going to let you rest your hands. So in a roll of towel or even a tissue paper. So I'm going to extend the patient's hand, do it like this, and also to let the patient explain that they just have to be comfortable and relax. And another thing is I have to ensure that I'm going to check which the patient's dominant arm, so that I will going to obtain the blood gas to its non-dominant arm. And then right now I'm going to check the I'm going to do modified Allen's test by occluding both the radial and ulnar artery, and then let the patient clench their fists for at least three times until I notice blanching of their fists. So after that, I'm going to remove my finger from the ulnar artery, and then I notice the patient's modified Allen's test is negative. I'm going to do it on the other arm. So right after I'm going to do my modified Allen's test, I'm going to prepare the necessary equipments such as the ABG kit by looking at it if the necessary supplies are complete, by the needle, the alcohol band-aid, the alcohol prep pad, the patient's label, the gauze, and even the cap and its stopper. So I have to prepare all this one, and then once I'm ready, I'm going to reassess again and position the patient's arm by doing like this, and then palpate for the pulse in the radial artery. And then before that, by the way, is before I proceed, by the way, is I have to obtain a proper PPE by wearing gloves, and even if possible goggles or even mask. And then once I'm ready to proceed, I'm going to take this alcohol prep pad, and when doing it, so by cleaning it, you should make it in a circular motion by cleaning the patient's wrist, not by doing it upside down, and then throw all in a proper waste disposal. So after that, I'm going to prepare the needle, remove the cap, and then when I position this one, it should be on a 45-degree angle. And then once I'm going to hold the needle, it should be like you're holding a pencil or a pen, like this. And then when prior to inserting it, the needle should be positioned like this and bevel up. So as you noticed, I'm going to position my hands 45-degree angle, and then when I hold it, it's like I'm holding a pencil, and then palpate the artery well until I sense it that I can push it through. So I'm going to push it through right away. Like, I need to ensure that my fingers should be away from it to prevent from any accident poking myself. And then once I'm done, I'm going to prepare the gauze, remove it, apply pressure by at least 3 to 5 minutes. And then once I'm done, if possible, if you have another gauze, we have to remove a little bit of air sample or even tiny clots or even push it through on this red cap. So after we push this one through, we have to remove the needle together with the cap and dispose it directly to the sharps container. And then once we're done with this, we have, if we already threw both the needle and the red cap, we have to